Welcome to another one of our Royds with E. King Herbs Palsy webinars, this time dealing with all things related to physiotherapy and in association with the Herbs Palsy group. I'm Paul Rumley, lead partner at the Clinical Negligence Department of Royds with E. King and a specialist in handling claims on behalf of people with Herbs Palsy. I'm joined by my colleague, Lucy Norton.
Hi, I'm Lucy Norton. I'm a senior associate at Royds with E. King in the Clinical Negligence Department. I also specialise in Herbs Palsy cases and birth injury, including cerebral palsy as well.
Thank you, Lucy. And doing this webinar in conjunction with the Herbs Palsy group, which is still the only national charity dedicated to Herbs Palsy. We're also extremely fortunate to be joined by Kim Hawksby, who has been a member of the Herbs Palsy group since being a child and who takes an active role in the work of the group. Kim regularly speaks at the Herbs Palsy group's professionals conference, which is designed to educate midwives and therapists about the true impact of having Herbs Palsy. Kim has worked as an occupational therapist, specialising in orthopaedics and trauma, paediatrics and elderly care. Both being an occupational therapist and having Herbs Palsy herself, Kim is able to give us both a personal and a professional viewpoint during this webinar. Welcome, Kim.
Hi, thank you. Hope you find this webinar informative and useful.
Thank you, Kim. And we're also very lucky to be joined by Susan Filson, who has been a qualified physiotherapist for over 40 years and has worked extensively with the NHS at some of England's largest hospitals. She was a director of physiotherapy and oversaw both adult and paediatric services, including medical, surgical, and neurological injury rehabilitation. As well as currently consulting and treating patients, Susan has been involved in researching the benefits of water therapy, hydrotherapy, and swimming, plus the suitability of disabled access to leisure centres and swimming pools in Great Britain. As an expert in her field, we therefore welcome Susan to share her views and knowledge about physiotherapy generally and in relation to Herbs Palsy injuries. Welcome, Susan.
Hello, everybody, and thank you for inviting me to talk tonight.
You're very welcome, Susan. And most importantly, we have David, whose son has Herbs Palsy and whose claim we are currently progressing, to talk about the challenges that they as a family and their son have and continue to face with Herbs Palsy. To preserve anonymity, we're going to refer to David's son as B or your son throughout. But I can confirm that their son is 13 years old and has a grade 2 brachial plexus injury affecting his left arm. This leaves B with a significant permanent reduction in range of movement, grip strength, and function of his left arm and hand. He has not had surgery, but has received physiotherapy and hydrotherapy treatment whilst growing up, and his parents have actively encouraged him to participate in all sorts of sports to maximise his potential. David, thank you very much for joining us this evening and for giving us the parent voice, which is very important in this discussion. So welcome, David.
Thank you, and thanks for the invitation.
And so without further ado, Lucy, our first question, please.
Yes, thank you, Paul. Our first question is directed to Susan. These are questions that arise from families we speak to, especially those who have sort of very young babies when they come to us. How soon after Herbs Palsy is diagnosed can you start physiotherapy?
I actually have in front of me the obstetric brachial plexus, the Herbs or brachial plexus palsy, whichever way you want to say it, the guide to management, which the Association of Paediatric Chartered Physios have actually done, and I'm sure it would be available if anybody wanted it. And they actually say that within a week of birth, when it's been diagnosed, then within the first 24 hours, they should be assessed. And after that, the treatment should be started within a week.
Thank you, Susan. And I'm afraid the next question is also for you. As we said, if anybody else wants to come in, do. So question for Susan again. Do nerve conduction studies help with targeted physiotherapy?
Yes, because it helps with the actual areas of muscle that are damaged. But as a physiotherapist, we're looking at function as well as just physical movement. So we tend to look at that. So if it's not done, we can still treat the person.
And finally, Susan, sorry to come back to you. We will go into the others soon. Are there any additional benefits from hydrotherapy as well as or instead of physiotherapy?
Physiotherapy is the word physiotherapy is really an advisory role as well as a hands-on role for people with Herbs palsy, because you're educating the parents, the family and the person as to what they should be doing to maximize their functionability on a daily basis. So you don't do physiotherapy with somebody every day. As a physiotherapist, we advise the programs that will benefit them. So it's more, there's a lot of advisory involved there as well as some one-to-one stretching. Hydrotherapy, warm water and buoyancy in warm water is a wonderful medium. I would say that because that's my favourite thing. But if one can imagine that if you have very little active movement in your arm, either the muscles are very weak or they're not working at all. If you're standing in a swimming pool, one knows that the arm comes up, it becomes buoyant. So you get some movement in that arm for no reason, because it goes down and the water brings it up. So you can put the person can be in lots of different positions in water, and you actually get some movement in the arm that you wouldn't get on dry land. But then you can also use it using the resistance of water and work in the other direction. So water is a very useful tool for any area of the body where the muscles are weak, and to make the range of movement of the joint within a limb easier.
David, I think your son has had hydrotherapy, is that right?
He had, yeah. He had limited access because of the problem we had at the hospital where he was having the hydrotherapy. He did have several sessions when he was very young.
David, back to you. How much information were you given about Herbs palsy generally and specifically about physiotherapy when your son was diagnosed with Herbs palsy?
We wasn't actually given a massive amount of information. We was very much in the dark for a long time. Obviously, we knew that there was a problem and we was referred on for physio virtually straight away. You know, we were in the dark for a while. It was just trying to understand. I think it was more the fact that we was trying to get into our heads what was going on, you know, which probably made us feel like we was left in the dark. But yeah, the physio virtually started on him within a matter of weeks. We was doing physical work with him, not physiotherapy work with him.
I think what Susan was saying is also echoes your experience, doesn't it, Kim?
Yeah, I think one of the problems is there's such a difference between what services can provide, you know, within the different areas and the different trusts and the different localities. And, you know, where I used to work, I used to know that, you know, those with herbs shouldn't get discharged until they're skeletally mature. And I used to think, oh, I'm discharging them myself. And I know, you know, but from that was kind of where the pull was between kind of professional and someone with the condition who wants the best. But, you know, everywhere we work has got kind of restrictions and, you know, limited on resources and things. What's really important is to know how to get re-referred, you know, if they're talking about discharge and things are okay, you know, as they are and you're satisfied, but you're wondering what will happen, you know, in a month's time, in a week's time, in a year's time, in 5 years' time. It's how to get back in touch with the service. So the service that I worked in, we were very kind of goal driven. So we looked at, what the child wanted to achieve at that time. So when goals were achieved, we could discharge them, but they could access the service within 2 years just by ringing directly the therapy department and kind of missing out the step of going through the GP or a consultant to get re-referred in. So it's quite reassuring that although we could discharge the children, we were very clear on how they could access that. we were very fortunate. Not a lot of services, can offer that. And a lot of the time, by the time you've got to the top of the waiting list, it's far too late. And I think this is why a lot of people with Herbs Palsy tend to go down the private route, because it's for maintenance. A lot of the time, it's not necessarily to, kind of really kind of improve movement as such or function as such. Sometimes it is just about maintaining what you've got and not losing it. And that's often what the NHS doesn't provide, the maintenance work. I not been seen kind of on the NHS, apart from kind of post-surgical times. For many years, I go through the private route now, because when I need it and I've got a flare-up, I know that I can ring up and be seen in a week or so. I can book enough sessions. There's no kind of restrictions on how many sessions, what the sessions are. And there's just a big difference in the sessions themselves. So a lot of the time, kind of outpatients, you might be looking at a 20-minute appointment. Private, you tend to get kind of 45 minutes, an hour. So even the time that you get with them is often much more beneficial, really. But the downside is obviously the cost.
There was a question which was largely for Lucy and I, which I'm now just going to answer, which is about the mismatch between physiotherapy, what people need, what they can pay for. And it's just to say that it's one of the biggest benefits for anyone who has a claim, that actually the money, and it's so for any claim, but in particular for Herbs Palsy claims, the money's only useful for what you can do with it. And that's the big benefit, is that in an Herbs Palsy case, is that the money can be used to plug that gap, as we've already said, between what the NHS can provide, what you can afford on your own resources, and also, as Kim was saying earlier, to kind of smooth out the fact that actually you can then choose when you need the physiotherapy. And it isn't always when everybody else thinks you need the physiotherapy, because I know that Kim has sort of shots of physiotherapy at particular times after surgery and things like that. And so that's the real benefit of that. Kim, just to bring you in and tapping into your personal experience again, how much physiotherapy did you get? Was it NHS or private? And how active were your parents in relation to that?
So luckily, in most cases, things have changed a lot from when I was born, because my parents were told to not move my arm and to keep it as still while it heals. And not much was really offered. When I was still a baby, I did have some hydrotherapy and I had a little bit of physiotherapy, but again, they basically said I would be discharged because there's no improvements. And then that was it. So I had nothing. And my mum and dad were never advised on what they should be doing, to get the best out of it. And it's something that I know my mum still feels very guilty of. And she'll say, I wish I'd have done more. But I said, if you're not told these things, how would you have known? It's not because you were told and you just didn't bother, so there's definitely no blame on my part on it. But I know that does play, on parents' mind, are they doing everything they can, for it? And then really it was when I went to university, like we've said, at different stages. And, and like David, your son, when I was at kind of even primary school or high school, my arm didn't really bother me that much. I was very active, doing lots of different activities kind of outside of school and things like that. When I went to university, I've been brought up in a family where, like you said, you can do everything you put your mind to, just find different ways to do things. I didn't see myself any different really to my friends. And then when I went to uni, it was a bit of an eye-opener because I'd not got my usual network of people and things around me that I'd kind of relied on without really realising. So especially things like carrying even, my bag to uni, going shopping to the supermarket and managing that. I was finding those kind of things a lot more difficult and a lot more painful. So again, because I knew it would be far easier to see a private physio, I organised to see a private physio from when I was 18 in my first year at uni, and I've had a private physio ever since. When I went to the physiotherapist, I went in like this. And she said, why is your shoulder near your ear? And I said, oh, because I've got Herbs palsy. And she says, no, it is obviously kind of because of that, but it's because everything is so stiff and around it. So I went for, a block of sessions, had lots of taping, lots of massage, and actually, lowered my shoulder for the first time, and my body image was a big thing, and even the fact that, my shoulder used to be so high used to affect me, and looking at what clothes to wear. And, I was very kind of conscious of it. And to realize that was the first time that someone said, actually, that bit, if we manage this, it doesn't have to be like that. And that's when I definitely started realizing the benefits of going for physio and getting kind of the maintenance. So now I know that my shoulder will creep higher and higher and higher, but I know kind of with physio input, I can get it back down and loosen everything off. And then it is kind of when you go through different stages, and I always laugh. My first surgery, my wrist was unstable and I wanted to be able to hold things, so they did my wrist fusion. When I was at uni, a big concern was to be able to hold 2 bottles when I was out in town, which I couldn't really do without it getting knocked over or being in pain. So when I had my biceps surgery, that allowed me to hold a bottle, and I've got my picture of the first time I went out with a bottle in each hand. And then as you get older, kind of moving out into your own home, you're starting becoming much more independent, less dependent on your parents, so you kind of get a bit more kind of wear and tear. You're doing much more. The demands of your hands and your arms increase a lot kind of as you get older. And unfortunately, it's the very, very mundane, boring tasks like washing up, hanging the washing out, putting the wash, you're washing in your washing machine, unpacking your shopping. It's all the very, very boring tasks that do put a lot of kind of demand on your upper limbs and things. So kind of as I've got older and the demands increase, and the less you depend on your parents, from when you live at home, the more input I've needed really just to manage that side of things.
David, when was the last time your son had physiotherapy and actively involved?
He was very young. The physio stopped. To be honest, I can't remember his age, but he was very young. Basically, once they told us that the extent of the problem with regards to the words were, if he doesn't exercise on a regular basis, he would have a permanently dislocated shoulder. So we just took it upon ourselves to make sure that the activities that we do with him, and he still does today, is good for the range of movement that he needs to strengthen his arm. But like I say, the physio, I cannot remember his age, but he was very young. I think it was before his 6th birthday. It must have been a long time before that it just all dried up.
It sounds very sensible, and as sort of Susan has said, and I think Kim will probably agree with, it might just be that a certain life change point for him, he might go, well, actually, this isn't working quite as well as it used to, and that's when input might be helpful.
I think when he gets to the point where, which he hasn't done fortunately yet, where he gets to the point where maybe he's turned around and saying, this is starting to feel stiff and I'm struggling with, then obviously that's the point, I think, in which we will intervene and we say, right, we need to get you into some sort of physiotherapy or therapy of some description to help him out. But as I say, he bears, whether it's because he's a teenager and he just doesn't want to tell me anything, but his day-to-day life, he seems happy where he is and he doesn't complain about it. So I think when that point comes, like Kim says, as you get older, because I've never really thought, like Kim said, with regards to the good side, taking the wear and tear, you sort of concentrate on the bad side. You don't think about the possibility of there being problems in the long run with regards to, his good side. So again, it's something to think about with regards to, just general physio for his entire posture, to give him rather than just concentrating it, because he's not complaining about the left side being painful or stiff. I think it's maybe thinking about the big picture and his entire posture and well-being with regards to how his body is. It might be something to think about.
It's one of the most important, but one of the most difficult things we do in the claims is to try and look forward. Okay, it's fine now, but how's it going to be, when the client hits 50 or 60, and those kind of things.
One of the questions is, how soon do you see any benefits of physiotherapy? Can it be measured in weeks or months, or is it just an ongoing process?
If you're starting as a baby, then you don't realise there are benefits, but the benefits are that you're preventing the scarring and the non-ranging of the movement from a very early on. So that's a benefit, but a parent wouldn't realise it's a benefit because they don't know that the arm isn't going to move anyway. So it's difficult to say if it's benefits. It's preventing, it's trying to maximise...
Prevent deterioration.
Yes, prevent deterioration and maximise the physical and functional potential of the person. So if you measure that as benefit, then yes, there's true benefit. There are some measurements that are being done these days, but that's more on certain scales as to what the movement is and where you're up to and things like that, rather than knowing a true benefit.
In terms of individual function.
Yeah. So
fine. Well, that kind of leads into my other question. Is it ever too late for adults with Herbs palsy to benefit from physio? That's
also very interesting, because I did a case, and I've just pulled it off, and I shall just call her Miss X. I was joint in this particular case, and she'd had very little therapy, very, very little. And I was asked to go and see her. She brought a case only out as an adult, and she hadn't had any at all. And she was a nurse, actually. Well, she was an auxiliary nurse. And we put some physiotherapy in place for her. And yes, there were benefits. She definitely got some increased range of movement, some less pain. She learned things. So yes, there was benefit from as late as that.
That's really good to know, because I do know where children have kind of fallen out of the system and can't get back into it, or you don't necessarily have parental engagement. That when they are old enough, it's, to be more responsible for their own physio or long-term goals, that there is that benefit to be had.
I mean, you might not increase the ranges of movement because there might be that much scarring there that, it's fixed. But again, this young lady wanted to learn to swim. Nobody had ever given her the opportunity to get in water because they didn't think she would. And she got swimming. So it's definitely can help.
That kind of handily leads on to sort of the next question. Are there any sort of key stages or developmental milestones? So obviously puberty is probably one, but is there any specific ones else?
I always like to split it up as sort of up to about 6 or 7 with herbs, because and this is not probably a politically correct thing I'm going to say, but they're more puppy-like, the children. They tend to jump off settees and climb on things and do their own physiotherapy when they are toddlers and when they are young. Then they get to a stage where they go to school and they're with other children and they don't want to do any of these things. So at that stage, then you need to get involved with the sport or the more interesting activities. And then when we go through puberty, anything from 9 to 14 these days, you really need to be watching and showing them what can need stretching and what's happening with the growing. And then I always say when they go to university, when they've left school, you do need some input, because you don't always get a disability room, or you don't always get, so a physio to just pop into the university to see what they've got to do, carrying a bag, what maybe that's in high school as well. So there are certain stages for that. And then often I say with the women, when they've had their babies, about how they should carry the babies and bath the babies and things like that. So that's another stage to go through with the men, even anyone, men and women, when they've got a desk job, the best way to sit. So it's every stage of life change is important to have just some physiotherapy input to advise and help on posturing, really, and movements.
And would you say in particular, I'm sort of looking at my own children who have sort of sprouted quite considerably in a short space of time, is that when it's important? So if they have a big growth spurt and, bones and muscles must be changing at that stage?
So yes, and the other part about it is your body shape changes. So a lot of the time with the herbs, you've got shoulder problems as well as the arm. So the shoulder does what's known as abnormal shoulder movements. Now, as a child, you're much more flexible, but as with men, when the body shape changes, these muscles change and have different pulls. So you need the advice on that to explain with that. And with the ladies, interesting enough, girls start wearing heels. So when the girls wear heels, they change the posture, the head comes forwards, and it's more difficult to lift the arm up. So makeup, often that's when an occupational therapist is very important as well at those stages, because people want help with the makeup, with the hair. Can't do it because you can't, it's not easy. And lenses, I have seen a lot of patients struggle with putting lenses in when you've got herbs, because you really do need very good fine hand movement to put lenses in. So that's not easy. So there are various, I would almost say, stages and things that happen to you in your life. So life-changing stages that you need the input from the physio and the OT.
What are the top tips that you would give to someone or a family of someone with Herbs palsy in terms of physiotherapy?
At what age? As a baby, do lots and lots of stretches every time you change the nappy, every time you bath, playtime, roll them on the front, lots and lots of postural changes as much as possible. Include the exercises that are given to you on a 24-hour basis as much as possible. As a child, get them involved in sport, let them do whatever they can do, exactly as David has done. All credit to him, and very humbling to listen to how you have been with your son, David.
Thank you.
Excellent. I would say followed. So as a teenager, to make it, for the family to make it fun and around what they like to do, to get advice to make sure that the therapist, and as an adult, it's to just go and get the right advice when they need it. And as Kim says, when you're in pain and when you need it, to make sure you source the right physiotherapist. So it's different stages again, and use the physio and the OT. And actually, joint sessions can be very useful, can't they, Kim? Joint sessions with the physiotherapist and the OT, because as much as we see a lot of similar things, we've both got our own little specialties. So the two heads are excellent, especially when it comes into the workplace, or when this person with herbs has families themselves. If you can put those two people together there and have even 1 or 2 sessions with them, you'll get a lot of benefit from that.
I hope that the people watching will agree that we've covered a very wide range of practical issues. And so we hope it is of real help to people with Herbs palsy and their families. So it remains for me to thank very much Kim Hawksby of the Herbs Palsy Group, Susan Filson, our expert physiotherapist, and David for all of their helpful insights. If you want any further help or input, please go to roydswithyking.com or herbspalsygroup.co.uk. And thank you for watching. So, Kim, what are the benefits of joining the Herbs Palsy group?
There's many benefits of joining the Herbs Palsy group, but I think the main thing is that everyone involved with the person with the Herbs Palsy knows that they're not on their own, so the children see other kids similar to them and get benefits of that. The parents get to speak to other parents, grandparents get to speak to other grandparents. The whole thing of when you are on your own and you've got little information, it's I can only imagine that it feels very, very daunting, and at times you feel like you're the only person that's kind of going through it. And I know even sometimes for me, even now, like I'll put something on the Facebook Herbs Palsy group, like, oh, this, is this anyone else, and there'll be umpteen people, oh yeah, that happens to me, or I get this, and you think, oh yeah, that's reassuring to know. So that kind of support you get from the others is really important. They have really good resources. So we've said about kind of the physiotherapy and everyday activity resource. There's a really good, if I did contribute to it, so even if I do say so myself, but there's a really good teenage and young adult resource kind of booklet that goes through lots of different information and aids and adaptations. When you get to the tricky years where you start becoming more independent and you need to kind of know, what's out there, kind of aids and adaptations or just advice or different ways to do it. So that's there. And again, there's lots and lots of different information and resources. And they just start up to date with the best advice that there is. They attend all the international conferences. So the group itself, I forget what they call. They were a committee. What are they now? They're
Trustees.
Yeah, so the board of trustees are all really knowledgeable about it, and they've all got a connection to it, whether they're a parent or they work in the field. So, to get any kind of best advice and up-to-date advice, they're the ones to go to, really. And they're all very lovely people.
I hope that the people watching will agree that we've covered a very wide range of practical issues. And so we hope it is of real help to people with Herbs Palsy and their families. So it remains for me to thank very much Kim Hawksby of the Herbs Palsy Group, Susan Filson, our expert physiotherapist, and David for all of their helpful insights.